So my name is Zabe Bent, as Trinity mentioned, and I'm the Director of Design at NACTO. And most of you are fully aware, hopefully, that we recently released a document called Streets for Pandemic Response and Recovery. So we're going to focus a little bit on open streets, but just talk more generally about how you can center equity in the pandemic response in city streets. And as Trinity mentioned, NACTO is an organization that covers about 86 different transportation and transit agencies across North America. But for this specific effort, we were able to collaborate not only with North American cities, but also with global cities through our partners at the Global Designing Cities Initiative to stand up a transportation response center within a few weeks, really, of the pandemic kind of striking the US. And this helped us to understand what cities are doing across the country and across the world, and also to share some of those tools back with people. And as we were doing that work, people said, we would love for you to really condense this into one place. So one of the things we wanted first to understand is what are some of the trends that we're seeing with city actions? And a lot of them at the beginning were focused on open streets or slow streets and sort of expanding the amount of space that people need for physical distancing. And you'll see that in many of the European cities, partly because they were ahead of the US on the curve and partly simply because they had more resources and sort of focus on what was happening, they were able to stand up specific projects, some of which were permanent in nature and some of which could be expanded from pop-up to permanent. And then others were more expansive on the network side and sort of looking at much larger networks than many of the US cities have. But we've also seen many cities look at how they can use shared streets for social distancing to advance equity and safety and security on our streets and sort of pedestrian safety, and also transit to support their economies and to support their essential workers. So this specific resource is intended to be an ongoing resource, and I apologize to anyone who came here thinking that they were going to get nitty-gritty details for all of the designs, because quite honestly, many of the cities that we work in, the staff know how to design streets. They have, very nitpicky questions about where to use light materials, where to use heavy materials, where to place this or that sawhorse, how to find precedents showing that other cities have done this in the US or in their specific type of environment. And so instead, what I'd like to do is focus on the principles. And the principles are something that I think really help people to understand how to think about planning and how to think about implementing these types of resources. And the first one is supporting your most vulnerable people first. Those communities are people who are essential workers, and that could mean medical staff, it could mean your transit staff or transit operators, it could mean grocery workers, any number of different types of sort of essential workers and communities, and particularly because a lot of people of color and sort of marginalized communities tend to fall into this category, but not exclusively so. The second one is following public health guidance. This one can be really dicey because there is such a change and a variation city by city and state by state. But this document really is a resource for responding to the pandemic, not just how to design streets, because we've been talking about this for years, if not decades, but specifically how to use streets to respond to what's happening at the local level, and specifically in response to the pandemic. And you can see that there's a variation, and one of the things we want to make sure is that people are prepared for not just the variation state to state, but the variation week by week or month by month, and creating some flexibility. When we talk about bringing communities into the process, I think one aspect of things is how to reach out to communities, how to coordinate with communities, and understanding what types of projects and sort of how to tailor your projects. But I'd also push a little bit further and say, what types of projects are needed? How can you combine what your normal work plan is with your response to the pandemic? How can you combine whatever the sort of projects that you're already planning to move ahead, or if you're pivoting to pandemic response, how can you use the data that you already have to make sure that they're responding, those projects are responding to community needs? And so I did want to spend a little bit of time just focusing on the fact that a lot of people talk about shared streets, slow streets, open streets. But in essence, this is just a place to start. Any type of slow street, which is a street that operates at 5 to 15 miles per hour or less, streets where they're closed off from car traffic or sort of prioritized for local traffic. That is sort of one thing that you can do, is to make that space available for walking or biking or play. But there are many other types of services that can be combined with that type of setup. And so one of the questions is, again, looking at what is needed in the local community, in the local environment, and how can you layer on top of the shared street or slow streets program. When we look at this resource, one of the things that I want to mention is, again, that the variety of different types of projects. If I'm actually going to go back really quickly, if I look here at the types of projects that we have, these are all things that we could categorize as slow streets or shared streets. Probably the one in the bottom left is the one that's most recognizable to people, which is just a sort of open environment for people to walk and bike. But we also have examples of testing. We also have examples of setting up sort of encampments for people who are experiencing homeless, school streets in the borough of Hackney in London, and even sanitation services outside of a bus station in the case of, actually, I can't, also in Brazil. And so again, the question becomes like, what happens, what sort of is unlocked for the local environment when you have much less traffic on your streets and when you have much slower movement? And here are really a broad range. With that, there are lots of things that we can talk about in a lot more detail. I think I just want to seed a question for you before I hand it off to Dr. Destiny Thomas, and that is thinking through what your current work plans are. Are your current work plans aligned with your sort of citywide values for the use of streets, and how can they better advance equity? Again, thinking through like how your budgets are structured, particularly because they might be quite tight. How can you use your existing work plan, your existing structures to advance equity? With that, I will go on to Dr. Destiny Thomas.
Thank you very much, Zabe. So my name is Dr. Thomas, and at the Thrivance Group, we have a method for literally doing everything. And sometimes we use the term dignity, sometimes we use the term Thrivance. But today I really want to offer up some ways that we can take the values and practices that Zabe just spoke about and really transform that into thinking about how we begin to plan at the speed of dignity. Next slide. So we use the word Thrivance a lot in our work, and not to get too academic on folks, but Kimberly Crenshaw, one of my favorite theorists, created or helped us conceptualize intersectionality theory, which is this understanding that the way a person experiences life and the way they experience society and our social networks and social systems have a lot to do with the overlapping connections between structural racism and oppression and how that is visited upon them. And so as somebody who is a Black woman and who moves through the world with these same hyper-racialized experiences, it became really important to me to identify ways to not just serve community, but also work with government agencies and decision makers to develop processes and methods for reaching communities, for doing engagement, and for developing policies that don't require a person to relive that trauma or be characterized by that trauma in order to be seen as human. And so the Thrivance method really is just what we refer to when we talk about how we infuse dignity into everything that we do. Next slide. So I want to share some ideas about what this looks like in the time of COVID response in the built environment. And a lot of times when I'm talking to people about the pandemic and what our responses should be from a land use and transportation planning perspective, I find that the conversation often veers toward, what I would categorize as notions of comfort, right? And our comfort has been disrupted. We're having to figure out ways to form kinship, ways to make decisions about our lives, ways to maintain, access to the economy, ways to stay healthy, and we've experienced collectively a major disruption in what would typically be our comfort zone. But it's important as we talk about this crisis that we understand the nuance and the distinction between what is truly a crisis and urgent and what is just disruptive of our comfort. And so when we start to have conversations about specific modes, right, like prioritizing bike lane projects or restricting travel for vehicles, or what do we do about transit connectivity, what we're really saying is, how do we maintain the level of comfort that we had before this pandemic showed up? When we start to have conversations about how we keep our timeline and how we stay on track with project delivery and how we continue to be advanced and innovative in our work, how we use this moment to garner political will for projects that maybe communities weren't leaning into before. All of this centers the convenience and comfort of people who have access to power, access to privilege, and decision-making authority. But if we advance to the next slide, I think there's a way to look at our response and frame our response really from a root cause analysis. And so harm reduction is a model that I first encountered in the city of Oakland. I also encountered it on, I forgot what TV show used to have it, I think Power. But harm reduction is this practice that comes from the public health industry. And harm reduction tells us that we meet people where they are, right? We don't meet people at the juncture of harm, but we meet people at the place, at the conditions that stem from the harm that they're experiencing. And so in this context, there were so many things at play, and there are so many things at play in this moment that we need to take into consideration, aside from just the things that were on the previous slide. So we still need to think about, obviously, the legacy of racism and how that's showing up in our day-to-day lives today, as well as in our responses to the pandemic and other crises that are popping up. COVID-19 is actually raising awareness about pre-existing health disparities that are also incredibly racialized and also tied to economic status in the United States. Environmental toxicity is a type of harm that's been showing up, especially in Black and Brown communities and historically redlined neighborhoods, that not only is just cruel and harmful in and of itself, but is worsened and like exponentially in a time of COVID-19, right? We've had this issue of trying to figure out how we slow speeds on our streets because people are dying. And again, Black folks and Brown folks, our elders and our children are dying at disproportionate rates due to vehicle crashes because vehicles are speeding. The economy, although we've sort of been in this bubble and thinking that our economy was recovering, I think what COVID-19 showed us was the fragility of that assumption. And the people who are already experiencing economic disparity are really feeling that now. And then lastly, are all of the decisions that we've made about land use and planning up to this point, all of the ways we have prioritized and deprioritized certain communities through our investment practices are now coming to surface as we begin to evaluate exactly how we should respond and where we should respond. Next slide. So I want to talk through what harm reduction is so that you can have this. This is just one example of a framework that you could apply to your analysis when you start to evaluate how to show up in the built environment with solutions. And I want to highlight a couple key pillars in the harm reduction model. So harm reduction is a set of strategies and ideas aimed at reducing negative consequences. So it's not It's not an absolute solution to the problem. It's not something that pretends to have all of the answers right away. It doesn't attach a timeline to a desired outcome. It's a way of looking at things from a strategic perspective with the sole intention of reducing the negative impacts that are all of those crises and types of harm we're experiencing are having on us. Next slide. Aside from being a strategy, harm reduction is also, it also has origins and stems from various movements for social justice. And that's because it's based on this belief that we have to respect the rights and dignity of everyone that comes in contact with us person to person, and that comes in contact with the outcomes of our decisions through policy making and through infrastructure planning. And so it's important to lift this notion of respecting people's rights. So respecting people's freedom of movement, respecting people's mode choice, respecting people's coping skills and coping methods during this time, and just addressing the conditions that are connected with those choices. So it's not just about addressing the conditions in the roadway, right? It's not enough to say we want to slow traffic. It's not enough to say we want to see more bikes. It's not enough to say broadly that people should just walk more. While all of those things are definitely ideal and surely comfortable, more comfortable conditions for us, what we should also take the time to consider is why people are choosing the modes that they're choosing, and how we address the conditions that they encounter in those choices. Next slide. So to that end, harm reduction as a framework really demands that our interventions and policies reflect not just individual perspectives, but broader community needs. And I think when living in this era, I am 35, and I personally have experienced 5 waves of gentrification, 5 different types of gentrification in my own lived experience, all ranging in degrees of aggression and how they felt when I went through them. But what I know to be true is that folks who are new to spaces that I've been in for a long time tend to have a very individualistic perspective of current conditions, and don't realize that the people who have been in that community longer don't just hold the institutional knowledge and oral history about how that space has evolved. They actually, their bodies actually hold the trauma and the negative effects of these long-term harmful dynamics like environmental toxicity. And so when we say things like more people should get out and ride bikes in a community like Oakland, California, for example, we have to think about more than just how the landscape looks and feels. We have to think about what is invisible, what's beneath the concrete that on a civil planning level that needs to be addressed, what's in the air, what's in the water that we're drinking, that oftentimes are root causes and contributing factors to the disparities that have made COVID-19 so terrifying and horrific for us today. Next slide. So finally, a core premise of harm reduction in this context is that there is no universal definition. We could sit here and give you a checklist of everything that you should consider if you want to be considered equitable in your approach. We could give you probably hundreds of pages of design concepts and pop-up frameworks. But what really we need to do is think about developing a path to harm reduction that leads to atonement for the legacy of harm in these communities. Next slide. So to wrap up, I did think about a couple of examples of what this could look like. And I think a lot of this stems to having quality message development and narratives that speak to the cultural identities, the racial identities, and the needs of the communities that we are working in. And so I have a brother who has a heart condition and a liver condition, and he's a teacher. And so he's really trying to think, and he's a PE teacher who also teaches science. And so he's really been trying to think creatively about how to continue to show up for his students while also advocating for his personal safety and health during this time. And so he and I are working together on developing an education navigator program for his school, so that the students that he teaches can have access to something called School Street. We really should start to take a step back to think about what comprehensive packages for reparations look like in the built environment. And I think a good point of juncture for that work is to consider the ways our environments have been deliberately planned to be harmful towards certain people. I think it's important to start to pilot new alternatives to first responder functions. So not just alternatives to policing, but how we define first responder and who should be showing up in those instances. And how do we reimagine the streetscape to support those activities? I love the idea of safe routes for mutual aid and having corridors designated for all modes for people to have easy flowing access to meeting the gaps, the needs gaps, the service gaps in our communities. I think that we need to, I love the slide that Zabe showed earlier where we saw tents in somebody's courtyard. But I think thinking about our curbside community and folks who are unhoused and how if we are going to reclaim and repurpose space, how we can prioritize their need for shelter through those steps. I think transformative justice is important, or a lot of people know the term restorative justice. Whatever we can do to start to have more discourse and action tied to that discourse around acknowledging the legacy of racism and slavery and how that is showing up in folks' bodies and environments. Now is a great time to do that. I think subsidizing all modes of mobility is important. I think if those of us who are planners and engineers have an understanding about the dangers and toxicity and harmful nature of vehicle dependency, then we should have a real conversation about how we level the playing field in terms of mode choice. And I think subsidizing those options is a great first step. And then lastly, thinking about how we fund block-based programming so that we're not just having open streets or slow streets, but that the communities that live in those areas can really start to have a sense of social cohesion and connection to one another in a socially distant way. And an example of that in the Black community, we love funerals. We love our funerals, right? Those are family reunions for us. We celebrate in them. And COVID-19 has really, which is killing a lot of Black folks, has been doubly harmful in that we haven't been able to have dignified send-offs. So thinking about how we plan corridor space for processionals is really critical too. Next slide. Thank you for having me and for allowing me to add my voice to this conversation. I will just leave you with one question, and that is not just who you should serve, but who should be leading the service of those people. And I'll hand it off to Ariel.
Thank you. That was excellent. So, hi everyone. I'm really, really excited to be here with you all. My background is in transportation planning and engineering. In my typical role, I'm a staff engineer working on bicycle and pedestrian projects, but in light of the pandemic, I've been tasked with examining additional ways to ensure that our COVID response and recovery projects are equitable. So I'm going to be speaking about a framework that is currently in development to guide our decision-making and evaluation process. And then also share a few questions that I believe is important to consider as you select the right programs as shared by Destiny and Zabe for your city. Let me go to the next slide. So I usually always start my presentations off with a quote, and it's something that I want to offer for consideration. And I think both Destiny and Zabe have spoken to this, but in times of discomfort or uncertainty, we go back to what we know, we go back to what we're comfortable with. And centering equity in policy and programs is something that is still relatively new for a lot of cities. So as we navigate this crisis, it's more important than ever that we're centering historically marginalized communities. And so one way that you can do this is by having a set of questions, or one way we're looking at doing this is having a set of questions to guide the work. And we have 5 question areas to provide clarity around how well we are understanding the equity implications and benefits for our work. And as you can see, we decided that we wanted to keep these pretty basic so that they'd be easy to remember. Go to the next slide. So who and why are really at the crux of our guiding questions. We're hoping to set our prioritization framework up in a way that if you can't answer these two questions, shown that the project is not a priority. So if you're not able to demonstrate how a proposal is meeting an immediate need for historically marginalized community, or that it's not worsening existing disparities or producing unintended consequences, that it's essentially not a priority. And a lot of the focus, the reason that we have the why and the who, because there's generally a lot of focus on the who, but the reason that we have essentially these two questions is because there's a lot of focus on not creating new disparities in the programs that we're implementing. But we're saying to be truly equitable, we need to be utilizing our responses and our strategies in a way that is also meeting existing needs. So whether that's adapting a slow street to facilitate play for youth who haven't been able to be outside, or as I think both Destiny and Zabe shared, using a street or a slow street to facilitate the distribution of food through a food bank. We really want to be ensuring that all the strategies are meeting a need demonstrated in these communities. Go to the next one. And then next, we want to understand when the program is implemented or employed, what are the burdens and what are the impacts? So how are the benefits distributed, not just equally, like we could have an equal distribution of slow streets throughout the city, or we can have an equitable distribution of slow streets throughout the city. And what we know with that is that they might have to work in different ways. And so, for example, if you take like street eateries, some cities have processes where they give deference to businesses that are owned by women or businesses that are owned by people of color, or provide support when it comes to addressing, using the application. So these questions are really about reducing barriers to accessing programs and providing accountability to communities. And what we're seeing in light of this pandemic is that we're making decisions at a really rapid pace, but the impacts could be long lasting. And so we have to have a plan to mitigate those. And so those are the what and the when. And at a minimum, as Destiny just shared, at least have a way to be able to reduce harm. So we want to have strategies that are both qualitative and quantitative when it comes to understanding impacts, and really reduce barriers when it comes to equitably engaging communities. Go to the next one. So in terms of justifying that need, there are several tools that can be used to answer these questions. So that could be anecdotal from community-based organizations. As a project engineer, that has been something that has been really critical for me to know how do we best engage in communities that might have been harder to engage before COVID was even a thing, and now are even more of a challenge to potentially reach. So, the communities have been doing this work for a long time, and they really understand because they're still having to provide these services in light of everything that's going on. But then you can also use technical data. So a lot of the public health data that's coming out, what are the hot spots in the city? How are we making sure that our transit service is in alignment with, what public health is saying? So you really have to use a range of strategies to justify, or you can use a range of strategies to justify the need. And so ideally, we are saying that a priority project, a recovery or response project that centers equity would have these key components. So once again, it's meeting an immediate need, and it's addressing existing disparities, and it's not adding to them or worsening them. And there's a plan to evaluate impacts and mitigate harm for historically marginalized populations. And then also lastly, that cultural, linguistic, accessibility or economic barriers can be addressed to equitably engage stakeholders and community members. And this one is particularly important, especially considering all of, as Destiny mentioned, all of the other things that are happening right now in the current climate, where communities have economic things that they're worried about. They have health things that they're worried about. A lot of them are essential workers. So really making sure that we respect the capacity that they have to engage, and not just, it could be easy to say, well, they don't have capacity to engage, so we're going to just go ahead and move forward. But because we know a lot of the needs and disparities that have already existed, it's not like we don't necessarily have solutions that we were considering before this happened. So maybe sometimes it's pivoting to how do we accelerate some of the things that we had already planned, and really, instead of maybe proposing a new project where we can't engage a community. So that last piece is definitely something that is important to consider. And so a question that I would like to offer to the mayors is, how do you see your role in setting the tone for equitable response, particularly as it pertains to different transportation strategies?